All right, my name is Josh Halls, doing a health history exam with Jessica here. Jessica, before we start, I'm just going to make sure we have your consent for you to be recorded on this video and posted to my school.
Yes, that's fine.
All right, okay, Jessica, go ahead and give me your name and age or date of birth.
My name is Jessica Halls. I am almost 35, and my date of birth is 4/1887.
Perfect. And what was your sexual orientation at birth?
Female?
Female. Perfect. There you go. That's great.
Tricky question.
Yeah. Perfect. Okay, what is your primary concern for coming into the office today?
I just try to get my yearly exams in, so I'm just here for my yearly wellness that my insurance covers.
Perfect. Okay. And are you currently having any present illness, pain, anything that would cause for concern?
No, I feel really good.
Okay, perfect. Do you have any allergies to medications?
I do. I have an allergy to naproxen.
Okay, what happens when you take naproxen?
I just get really itchy.
Okay, get really
So I've
itchy.
just really tried to stay away from that. So instead, I just use ibuprofen or Aleve
Okay,
if I need it.
Perfect. Any allergies to foods?
Yes, I have an allergy to gluten. I was diagnosed with celiac disease
Okay,
So I
how
just
long ago were you diagnosed with celiac
in
disease?
2018.
Okay, and how were you diagnosed?
I was having flu-like symptoms, sore throats, some IBS issues, so the doctor finally did a scope after doing several testing and found that I had necrotic bowel. So they did a biopsy, sent it for culture, and it came back with celiac disease.
Okay, and what have you done in your life to kind of...
I've eliminated gluten. I'm on a strict gluten-free diet. More of a lifestyle change for me.
Perfect.
And then I take vitamins and medications for it.
Okay, what medications are you currently taking for that?
I only take an ibuprofen if I need it. If I've been gluten, sometimes I'll just notice a stomach ache. So I'll take some ibuprofen for that, just as needed. And then I take probiotics, digestive enzymes, and vitamins, just to keep my absorption and my digestion working properly.
That seems to be helping with the symptoms.
Yes, tremendously.
Okay, and if you had a scope since then to determine how well your new diet is doing?
Yeah, so I had another scope about a month ago, and my GI doctor had told me that my bowel looks a lot better, more nourished, feels like I'm digesting vitamins and food a lot better than I was.
Perfect. So I'm gonna go ahead and kind of leeway that into some past medical history. I know we have said celiac disease. Any other illnesses in the past that
No, nothing too significant. I was diagnosed with celiac. My daughter also has celiac disease, so together we were diagnosed at about the same time. But as far as my own personal history, I have had recurrent miscarriage, and they looked into thyroid issues, and that's been fine. So they just think it's an unknown cause for miscarriage.
Okay, and how many miscarriages have you had?
I've had 3.
3 miscarriages. How many births that have had?
I've had
Or
4 full-term deliveries. I have 4 kids, 3 miscarriages, and then I recently just had an ablation after my last baby, which was, he was born 5 months ago.
Okay. Anything since that 5 months of the baby that has you kind of cause for concern?
No, I physically felt really well.
Okay. Well, what about a surgical history?
I've had 3 DNCs for my miscarriages, and then 4 vaginal births, and then I think that's everything, and then just 2 scopes for my bowel, but nothing more invasive than that.
Perfect. Any psychiatric evals or evaluations or anything?
No.
Okay.
No, mentally I've done really well. I've had to go on postpartum medications with some of my pregnancies, but not this last one. I have felt really good mentally.
Perfect. Are your immunizations up to date?
Yes.
Okay. Any screening tests that you've had within the last year?
No.
Okay. Any lifestyle issues or home issues that you need to discuss with me?
No.
Perfect. And so the medications you're taking, again, just once more so that I know, is just some vitamins, some natural supplementation, and some ibuprofen every now and then when you feel like you've gotten gluten. Okay.
Mm-hmm.
Okay, so family history. Mom and dad still alive?
Yes.
Okay, any issues with mom and dad? Any health issues family-wise?
Both of them are in their early 60s. My mom has a history of AFib, low blood pressure. Her parents from that side have cancer, high blood pressure, stroke, prostate cancer, and no other issues that I know of.
Okay.
And then
What about your father?
my father, 2 years ago, had a massive heart attack, has high blood pressure, high cholesterol levels, and then from his parents, diabetes, high blood pressure, stroke, breast cancer from his side of the family.
Okay. And what about your grandparents? Any grandparents on your dad's side still alive?
Yes, both are still living. He's the one that has diabetes. My grandma was diagnosed with breast cancer at a very young age, and then high blood pressure and high cholesterol, which
Okay.
kind of stems to my father as well.
Okay. And then what about your mom's parents?
Both are deceased. Cancer from my grandpa, that's what he died from years ago, and then my grandmother, who died unexpectedly this last year of unknown cause.
Okay. And then you just mentioned diabetes, hypertension, hypercholesterol, hyperlipidemia, and then some cancer issues. Okay, perfect. And then let's jump into a personal social history, okay? Are you sexually active?
Only with my husband?
Only with your husband, and no sexual activity prior to being married?
No.
Okay.
My last pap smear, I think, was about 6 months ago, and that was normal.
Okay, perfect. And then you guys live in a pretty decent location, not a lot of pollution, air quality is okay?
Yeah, I think everything's fine. We get our house tested for mold and for bad pollens, is that what they're called?
Pollutants? Yeah.
Pollutants, yeah. And everything seems to be fine.
Perfect. Feel like you got a good local support system?
Yeah, I have a good family support system, have a great family, have kids in school. My husband and I both work.
Okay, what do you do for work?
I am a registered nurse.
Do you feel like your work causes a lot of stress, or do you feel like you handle it well?
Since the pandemic has hit, I feel like it's been higher stress, but I feel like our work provides a good relief system and
Okay.
counselors if needed.
And then education, are you currently doing any schooling?
No, I graduated with my bachelor's degree about 4 years ago.
Perfect. All right, lifestyle. Tell me a little bit about your lifestyle. Sleep habits, eating habits.
My husband and I try really hard to provide good 3 to 4 healthy meals a day. Try to do a lot of meal planning, meal prep, and then we try to provide 12 hours of sleep for all of our children. Have a really good routine. Try to get our kids down at the same time every night, and then getting them up every morning. And then my husband and I try to at least get 8 hours, 6 to 8 hours, and work out every morning together for at least 30 to 45 minutes.
Awesome. Activities of daily living, do you find them hard to accomplish? Any issues with any of those activities of daily living?
No.
Okay, and I know you talked about trying to eat healthy, nutritional wise. Do you feel like you're lacking in any nutrition or your
No,
diet?
now that I'm taking care of my celiac disease, I feel like I'm absorbing and digesting foods a lot better than I was.
Okay. Any alcohol use?
No alcohol.
Tobacco use?
No.
Any illicit drugs?
No.
Perfect. Safety measures. Do you feel like you take care of everything safety wise? First aid kits at home?
Yeah, we've done really good on our 72-hour kits, first aid kits, car kits. I feel like we do a really good job with that.
Okay. How about spirituality? Do you follow a certain religion?
Yeah, I'm Christian.
Okay. Perfect. Do you feel like that is helping with mental status and
Yeah.
everything like that?
I feel like being spiritually balanced has helped my physical health.
Perfect. Perfect. Okay. All right, and now it looks like everything's going really well for you. I'm just going to run through a quick review of your system, start from head and go all the way down the toe, essentially, and try to hit all the systems in the body to see if there's any issues there. Okay.
Okay.
So anything. Sometimes we don't notice until someone actually asks us. Okay. And anything with in general, like recent weight change, clothing that fits more tightly or loosely than before, weakness, fatigue, or fever.
No, I mean, I've lost my baby weight. I had a baby, like I said, 5 months ago, and I had just like my generalized postpartum weight loss, which is normal for me. But I feel really good. I feel like I'm in a really good place as far as that goes.
Perfect. Okay, skin. Any rashes,
No,
lumps, sores?
no, I try really hard to have a good skin routine and
Okay,
wash my face at night. And
perfect. Any itching, dryness, color changes?
no,
Any changes in the nails or hair, size of color of moles?
I've had some hair loss, but I think that's related to postpartum.
Okay.
I've had 4 kids now, and I always lose hair about 4 to 5 months after having the baby, and it usually lasts about a month. But
And then it comes back after that.
yeah, but
Okay. Any changes or size changes or color changes in moles?
no.
Okay,
And I
perfect.
try to get my yearly skin checks, which I think I'm due for one, so I should probably schedule to get that.
Yeah.
appointment.
Yeah, make sure you schedule that. Just keep an eye on all the moles. Skin cancer is a big thing in this day and age with the sun but not so bright. All right, how about head? Any headaches, head injuries, dizziness, lightheadedness?
Mm-mm. No.
Okay, any eyes, any vision issues, glasses, contacts?
No. I do wear blue screen glasses. I work at a computer a lot, so I just wear my blue screen just to try to protect my eyes.
Perfect. Okay, any double vision, blurred vision, or spots, specks, flashing lights, or floaties in your eyes when you're looking?
No.
Okay, any problem hearing, any ringing or like high-pitched noises that you hear when you're just...
No.
All right, nose, any trouble breathing through your nose?
No.
Any problems like catching yourself being really stuffy or runny noses?
No. I feel really good. My nose gets dry now and then, but I think it's just the dry weather.
Yeah.
Utah weather is really dry right now, but I try to moisturize at night, and I feel like that helps a lot.
All right, perfect. And then moving to your mouth and throat, teeth, everything seems normal with your teeth. Any loose teeth, missing
I
teeth?
do have a missing tooth. I'm getting an implant put in this week
Okay.
that I had the original tooth removed before my baby was born, but now that I'm, postpartum and I'm doing a lot better, they're gonna put it in this week, but there's been no problems with it.
No bleeding gums, dentures?
Mm-mm.
When was your last dental exam? I know you said you're going this week, but
About 6 months ago.
6 months ago. Perfect. Okay, any sore tongue, dry mouth, frequent sore throats or hoarseness?
No.
Any trouble swallowing?
No,
Okay.
not since I've been gluten-free. It's been a lot better.
Okay. Any on your neck, any lumps or swollen glands or any goiter, pain, stiffness, anything like that?
Mm-mm.
Okay, perfect. Any moving down to your breast, any lumps on your breast that you noticed?
No, and I've tried to really be good about that. Every time I have a PAP, we do a breast exam.
Okay,
But with my
perfect.
grandma's history, I just try really hard to notice or feel lumps.
Any irregular nipple discharge?
No.
All right, respiratory, any cough, sputum,
Mm-mm.
any if you do cough, do you get any blood?
No.
Any shortness of breath?
Mm-mm.
When you exercise, do you have a hard time breathing?
No.
History of asthma,
No.
bronchitis, emphysema, or pneumonia?
No.
Okay, when was the last chest x-ray you've ever had, or if you've ever had one?
It's been years and years and years ago.
Cardiovascular, any heart issues?
No, not personally.
I know you said your mom has a history of AFib. Have you ever felt like your heart is beating irregularly ever?
Mm-mm.
Any history of hypertension for you, rheumatic fever, heart murmurs,
No.
chest pain or discomfort?
No.
Okay. GI, I know you already asked trouble swallowing, heartburn,
No.
Okay, any appetite issue?
When I was pregnant.
Yeah.
Wanted to eat everything, but since the baby's been born, I feel like I have a good appetite. Try to eat frequently, frequent meals, frequent
Okay, and
snacks.
I know you mentioned earlier about bowel movements. You have about one a day.
Yeah, I would say 1 to 2 depending on the day.
Perfect. Color and size of stools, normal.
Consistency's great. Frequency I feel like is normal.
Okay. Perfect. Any bleeding from the rectum when
No.
you poo? Is it black, tarry?
Mm-mm.
Okay, perfect. Any excessive belching or passing of gas?
No.
Wonderful.
Only
Any,
my husband.
any pain when like you push it on your stomach, or if your kid comes and jumps on your stomach at all? Perfect. Okay, any with peripheral vascular system or anything, any leg cramps, varicose veins? Do you have any past clots, history of clots in your veins?
No.
Have you noticed ever any swelling in your legs or feet,
Mm-mm.
calves?
Mm-mm.
Okay. Have you ever noticed any changing in your fingertips or toes during the cold weather?
No.
Perfect. All right, urinary system, frequency of urination. Do you feel like you're regular when you use the restroom? Any
Yeah.
pain when you pee?
Mm-mm.
Color seems to be that
Yeah,
light
it's
yellow.
like light yellow to clear.
Perfect. Have you ever a history of any urinary infections, bladder infections?
Mm-mm. Surprisingly, no.
Any kidney stones?
No.
Incontinence and all, which means that you will sometimes pee and you don't really know until it comes out.
No.
Okay, perfect. Musculoskeletal, any muscle or joint pain, stiffness?
Mm-mm. Unless I sleep wrong.
Okay. Any stiffness when you wake up or
No.
lower back pain?
Mm-mm.
Okay, and then I know you said you had an ablation, but have you had any irregular bleeding?
No, not since I've had my baby. The ablation took away my period, so I haven't had any bleeding.
Perfect. Okay, any nervousness, high tensions, mood changes?
No.
Any history of depression? I know you said you had a little bit of postpartum depression.
With previous pregnancies, but I feel like this one's been really good. I haven't needed to go on anything or feel like I needed to go on any medication for it.
Okay, any memory changes or memory loss?
Mm-mm.
Okay, perfect. Any attention? Like, do you catch yourself having a short attention span?
Mm-mm.
Any difficulty of speech or slurred speech?
No, I don't think so.
I know you already talked about headaches, dizziness, vertigo.
No,
Anything
I feel
like that?
good. Yeah.
Perfect. Any numbness or tingling radiating down the body in the fingertips or anything like that?
No.
Okay. Have you ever had any tremors or anything like that?
No.
Okay. Any easy bruising? Like if you were to bump into something, do you bruise easily?
No.
Okay. Have you ever had a transfusion before?
No.
Okay. And then I know you mentioned earlier about your thyroid, but you've never had any thyroid issues.
No.
And they checked for your, did
Yeah.
they pull some thyroid labs?
Mm-hmm.
And everything seemed to come back normal?
Yeah.
Okay, perfect. Well, it seems like everything seems to be normal. Your activities of daily living, you don't have any complications or issues with that?
No. No, I try to work out, try to move my body as often as I can.
Okay, perfect. Well, we'd like to see you back in a year.
Okay.
Just do another wellness exam, make sure everything's going okay. If there are any complications or issues, please come and see us sooner so we can make sure we get you taken care of.
Okay, perfect.
All
Thank
right.
you so much.
You are welcome. Have a wonderful day.
You too.